My name is Dr. A.P. Singh. I am in charge of the Department of Orthopedics. Today I will be discussing the problems which the elderly face regarding our bones and joints, especially arthritis of the bones and joints. These days, problems of the joints have become very common. Many of our friends who are above the age of 55 or 60 years are having problems in their knee joints and their hip joints. And when they are reading the newspaper or when they are talking with other people, they are learning that many of their colleagues or their seniors have undergone replacement. So I would just like to educate or talk a bit about this subject. Is replacement required for everybody? Before we undergo any surgery, we must first see that it is really required or not. As in the case of total knee replacement, first you should go to visit your doctor and see what symptoms you are having. Supposing you are having pain which is more at night, which is present during rest also, then it is one of the indications where knee replacement or joint replacement, for example of the hip joint also, can be carried out. The doctors should carry you through a series of tests, that is first X-rays, MRI where needed, and blood tests to see whether you are fit for surgery. If done properly, knee replacement and hip replacement have a very high success rate, that is 95 to 98%. And one thing which I also want to emphasize here is that you should choose a hospital or any doctor where you can talk to him freely about any problems you might face afterwards. And secondly, the post-operative care, whether once you have had a surgery, whether that doctor is accessible to you or not after the surgery. And that is one of the principal things which should be in your mind before you decide to go in for surgery. Second thing which I like to tell my friends, especially my senior friends, is to keep their weight in check and to exercise, like simple walking 20 to 25 minutes per day is sufficient to keep you in good health. Thank you and enjoy your health.